Hello everyone, welcome back to the Anatomy Lab. Today we are going to be taking a look at three bones, the sternum, the clavicle, as well as the scapula. And this is going to be largely the pectoral girdle with these two bones, but also its anchoring point at the thorax with the sternum. So let's go ahead and start here with the sternum, which is going to be the simplest of the three, which, although looks pretty simple, does actually have three parts to it. There's an upper part, a middle part, and a lower part called the manubrium up here, the body in the middle, and then the xiphoid process at the very bottom. So this bone is a flat bone. This bone is relatively thin but also wide. This bone is going to be covering the front of the thorax, and it's going to have the ribs attached to it, and largely it'll be covering the heart for the most part. But besides the ribs, there's also a couple places for another bone to attach, which is the clavicle, and that is going to be right over here on the sides and tops of the manubrium, which is going to be called the clavicular notches. So luckily, the name tells you exactly what you need to know. This is the clavicular notch. This is where the clavicle is going to attach. But furthermore, there is one more that you can see up here. It's a slight depression, and you might be able to see it very faintly, but this is called the jugular notch at the very top. So with that said, though, let's go ahead and take a look at our next bone. Starting from the sternum, we now travel to the clavicle. Now, the clavicle is a relatively simple looking bone, but there are actually some things that we need to take note of in order for us to be able to orient ourselves to the clavicle and look for at least a couple of minute bony landmarks. So to get started, let's look at our two ends of the clavicle. So on one end, you can see that it ends very sharply, and then you get this kind of rounded circular knob shape. This is called the sternal end. And that sternal end, as its name suggests, connects to the sternum. But if you look in contrast to the sternal end, which ends very sharply, you have this other end, which is actually going to kind of taper off and form this flat pancake-like end, which ends up being a little bit wider. This is going to be called the acromial end. And on the other end of the clavicle, that's where it's going to attach to our last bone, the scapula. Now, before we get to the scapula, though, there are a few more things to talk about regarding the clavicle. So this is a good indicator of this is a good indicator of how you can tell which side is medial versus lateral. So medial and lateral is very easily told by your sternal end and then your acromial end. But for superior and inferior, you can identify this relatively easily because if you look on the top, although kind of hard to see in the video, this is going to be much smoother. So the top part is smoother, but the bottom part is actually rougher. And you might be able to see some of that roughness in here. And there is actually a few landmarks that we'll be able to look for as well, including this groove under the clavicle. So this is the inferior side. This is the underside of the clavicle. So this is called the subclavian groove. So subclavian, under the clavicle, subclavian groove. But furthermore, there's actually a couple of minute ones that you can see here as well, starting off with this one right here. So this bump right there, this is going to be called the conoid tubercle. So the conoid tubercle is right over here on the posterior side of the clavicle. And then if you look really closely, you might be able to see that there's a roughened part here and a smooth part here, basically going from the conoid tubercle over to the acromial end. This right here, that kind of like line going across it, that is going to be called the trapezoid line. So going from the conoid tubercle over to the acromial end, this right here is called the trapezoid line. Now lastly, we do also want to be able to orient ourselves to this, or for this bone, and we already know at least a few directions. Lateral for acromial end, medial for sternal end, and then also superior and inferior with smooth side superior, subclavian groove, as well as rough side inferior. But then our last direction is anterior and posterior. Like you can look for the conoid tubercle That's going to be a great way to know that this is posterior. But there's an even easier way to do this as well. Like, find your sternum first of all, go to the top and find the manubrium, and you'll see the clavicle is attached. Now rub kind of like the front of your clavicle, and you'll see that it projects out forward. It projects out forward first, and then it goes back to your shoulder. So this is actually going to be the anterior side, starting from the sternum. This is the rounded part on the front, and then it goes towards the back towards the shoulder. So if I were to orient this to myself, this would be medial, lateral, anterior and posterior, and superior, the smooth side. So this would actually be a left clavicle. So if it were mine, it would be like this. So from here, though, we'll then go to the acromial end of the clavicle to attach to our shoulder blade, which is going to be right over here. So to take a look at our next bone, let's introduce that. This is the scapula. So the scapula is otherwise known as the shoulder blade, and it is a relatively unique looking bone, and a good thing to look for just to really identify pretty quickly. It's relatively triangular in shape. There aren't really any large holes in this bone, in contrast to another one that it might look familiar to or similar to called the coxal bone. But then it also does have a very unique and large ridge on the backside. This is called the spine of the scapula, or the scapular spine. So that's actually the first thing that I would look for, because this is very prominent, very easy to find. This is the spine of the scapula. And that is going to help with orienting ourselves to this bone, because this is going to be the posterior side. So that's already one direction down. This is the posterior side, meaning that if you do not see the spine of the scapula, this is the anterior side. So that's going to give us our two borders, or our two sides rather, posterior side as well as anterior side. Now that's also going to be good to help us find a couple of different processes as well. So if you look closely, here's the spine of the scapula, and then at the end of the spine of the scapula, you have this process that comes off of it. So if I were to show you it from a different angle, you can see that this is going to be attached to the spine of the scapula. This is called the acromion or acromion process. So this is where you get that name for the clavicle as well, because this is where the clavicle and the scapula will attach. The acromial end of the clavicle and the acromion or acromion process of the scapula. Now you do have one more process that comes off over here as well, so make sure that you can distinguish between the two. The one that comes off of the spine is acromion process, but the opposite one, the one that's slightly more or lower but also very anterior, like relative to it, this is called coracoid process. So I kind of pronounce that a little bit weird because a lot of people often like mishear or misread it. It's coracoid, C-O-R-A-C-O-I-D. So just be careful. This is the coracoid process, which is going to be like attaching to various muscles. But so far we have different processes as well as the spine and our different sides. But if you look closely, there's actually these very broad depressions along the scapula as well. So if you look at the spine, we can actually look for a couple of different depressions both above and below the spine. But first of all, like we actually have a term that we'll be using to describe different depressions of the body, which is called a fossa. So luckily, all three of these will be a type of fossa. So being above the spine, the word for above is supraspinous fossa. So above the spine, supraspinous fossa. Below the spine, infraspinous fossa. So supra, infra. And then on the front of the scapula, this is actually kind of like on the underside of the scapula, because this is going to be like flat, like on the back or the back of the thorax. this is called the subscapular fossa. And as we get to it later, like luckily these names will actually be related to a lot of muscles that you'll need to know, such as subs or supraspinatus inside of subscapular fossa, and so on. But with that said, there's a couple more directions that we need to orient ourselves to. We have superior and inferior, medial and lateral, anterior and posterior. Now, a good question to ask yourself is, well, you kind of know that this is lateral because of the shoulder, but also there's something even more obvious that helps you to find it as well. This right here is called the glenoid cavity or fossa. And this is a very kind of like big, unique structure to look for because it's going to be on the very lateral side of the scapula, sticking out completely laterally, because this is what's going to articulate with the head of the humerus. So the ball end of the humerus will actually fit right with this depression of the scapula, the glenoid cavity, or once again, being a depression, glenoid fossa. But relative to the glenoid fossa, there's actually a couple of bumps that you need to know as well, which is going to be above and below the glenoid fossa. So once again, what's above? This is supraglenoid tubercle, and then infraglenoid tubercle. So supraglenoid tubercle, infraglenoid tubercle, and once again, being that this is the lateral side, you have lateral border of the scapula, and then opposite, medial border of the scapula. Which, while we're at it, let's go ahead and go for another or a couple of more directions. Inferior angle of the scapula, superior angle of the scapula. And then one last one to take a look at, which is sometimes a little bit more prominent in another scapula, but if you look closely, there's this little notch right here, above, like kind of next to the coracoid process. This is called the suprascapular notch. And that's where you'll find a nerve and a blood vessel name for that as well, going right through there. So I know that the scapula, once again, also looks relatively simple, but there's some pretty big things to look for to help with like orienting yourself, but also try to consider those smaller ones as well, like the depressions, as well as the bumps, both above and below. Well, in this case, the glenoid fossa. So with that said, I think that's about it for now. So we will continue on and take a look at the rest of the upper extremity later, but for now, thank you for listening. Good luck with your studying, and I'll see you all next time.